This is Market Manager Larry Gothrop. We are fortunate to be able to share our news, sports, and hosts with our listeners. It's because of you we will continue to work to be better in the months and years to come. So on behalf of our entire WHBC and Alpha Media family, we wish everyone a happy and safe holiday.
The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local health marked pharmacy. I'm your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Kiko Auctions, and of course our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist, and our special guest from Mercy Medical Center, rheumatologist Dr. Alexander Hannan. Good morning. Welcome to the show.
Hi, it's great to be here.
When the body recognizes an infection or something harmful, our immune system reacts and becomes inflamed. This inflammation attacks the bacteria or the threat, which can include infection, for example. However, inflammation can sometimes last too long and cause negative effects on the body. Some examples of this are seen in rheumatoid arthritis, gout, and other conditions. About 1.5 million people in the United States have rheumatoid arthritis, and out of that number, nearly 3 times as many women have the disease compared to men, according to the Arthritis Foundation. Treatment options are available, and today we're going to learn more about inflammatory conditions and those treatment options. We'd like to remind our listeners that our program today is also available on our podcast, which can be downloaded from the App Store of your favorite smartphone. Just look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anywhere, anytime. If you have questions you'd like addressed today, you can post them up to our live Facebook feed, or you can give us a call here at the radio station at 330-450-1480.
So, Doctor, tell us a little bit about yourself and your role at Mercy Rheumatology.
So I've been, I kind of come from all over, as I tell people. I was born in St. Louis. I kind of moved around a bunch as a little kid, was raised in New Hampshire, then came back, went to Case Western for college, graduated with a political science BA degree, and then went from there to New Jersey at what was then the UMDNJ School of Osteopathic Medicine. It's now Rowan University School of Osteopathic Medicine in Stratford, New Jersey. Came from there, did internal medicine residency at Indiana University. That's in Indianapolis, Indiana. And came back here and did a fellowship in rheumatology at the Cleveland Clinic. And so I just finished fellowship a few months ago in July and just kind of started seeing patients at Mercy in September. And so what I do right now at Mercy, as far as you know, what it means to be a rheumatologist. I'm the first rheumatologist at Mercy, at least in recent history. So what we do, as you alluded to, is we treat not just kind of inflammatory conditions, but a variety of other conditions as well. Everybody kind of focuses on arthritis. That is one of the most common things that we treat, all varieties of it, whether it's kind of wear and tear osteoarthritis, whether it's inflammatory arthritis, as we call it, rheumatoid arthritis, psoriatic arthritis, and so on, and things like gout. But also we do a lot of systemic inflammation. So, for instance, things like vasculitis that can cause inflammation and disease in many other organ systems of the body. And we also tend to treat... we kind of have this reputation for being good diagnosticians, and that's something that happens with rheumatologists kind of everywhere. I kind of joke sometimes it's a little bit like being the house MD specialty, because I really never know what's coming in the door. And so I can get consultations for all kinds of things. Even since starting here, I've diagnosed anything from severe hypothyroidism, hepatitis C, HIV, cancers of all kinds. You know, so I see and treat and end up diagnosing a lot of things that aren't necessarily rheumatologic diseases. On top of that, doing things like fibromyalgia, kind of chronic, you know, to some extent chronic pain as it applies to centralized pain diseases like fibro. Sometimes we do cover that as rheumatologists as well. Primarily, I do outpatient work. I at this point, I don't see inpatients at Mercy.
Okay, so break down the types of arthritis. There's multiple kinds, you know.
Sure,
and,
yeah.
You know, somebody says, I got this, I got that.
Right.
Okay, you know.
Right. you hear all the time somebody says kind of, I've got arthritis. And so the question, like you say, is what kind of arthritis? So it can be boiled down into kind of three big groups with, to some extent, then there's kind of a fourth group of kind of oddballs, so to speak. So one big group, and probably the biggest and most frustrating group for both patients and for any medical professional trying to treat it, is osteoarthritis. This is the infamous wear and tear arthritis. You hear about people,
stuff like that, joints, things.
Absolutely,
like that. Okay.
Absolutely. When you hear about somebody who's had cartilage damage, or you hear people talking about bone-on-bone arthritis, a lot of times that is osteoarthritis. This is where the cartilage, for whatever reason, in a joint has become over time worn down, and this is usually by pure mechanical stress. And we're trying to understand a lot more what that is and what that means and how to intervene on it. Because right now we actually don't have any good way of really doing that, unfortunately. So there does seem to be a genetic connection. Like there are some people who, even up into their 80s or 90s, have joints that look great, don't really have much osteoarthritis. And then some people who, for whatever reason, in their 30s and 40s are starting to get significant osteoarthritis. There is an element of use kind of injury to it as well. So for instance, if you do a lot of heavy labor, if you work with your hands, you are going to have more joint damage that way. And it tends to damage the joints that are being used the most. So if you work in the steel mills up in Cleveland and you're lifting heavy things, but you're walking around with them, you may have a lot of osteoarthritis in the joints of the hands, the wrists, the elbows, but also the knees, the feet, those sorts of things. So that's osteoarthritis. Then there's another big category of kind of conventional inflammatory arthritis. And so this includes everything from rheumatoid arthritis, which is statistically speaking probably the most common one, to what we call spondyloarthropathy, which is another family. Mostly this is psoriatic arthritis, but this also includes things like reactive arthritis, IBD-associated arthritis, ankylosing spondylitis, and so on. And there's many other kind of subtypes of this. Lupus can be...
Spondylitis, big word. What is...
Right. So this is again, it's... Spondylitis and kind of spondyloarthropathies. It's a family of inflammatory arthritis that involves specific joints. It can involve the lower back, specifically the sacroiliac joints, in a way that other kinds of arthritis usually don't. It can affect, again, small joints of the hands and larger joints, knees, ankles, elbows, and so on. It can be involved. It's associated with a lot of other symptoms that are distinct from other kinds of arthritis. So classically things like psoriasis, other unique kinds of skin rash, eye inflammation, especially uveitis, and as well as kind of the inflammatory lower back pain that I had described. So that family vies with rheumatoid arthritis for being the most common inflammatory disease that we treat. There's some fairly large percentage of the population, up to 2% or so, that has either rheumatoid arthritis or the spondyloarthropathies. Then, aside, and also included in that inflammatory family includes things like lupus. Lupus can cause a lot of our arthritis, a variety of other kind of diseases under that umbrella, dermatomyositis, Behçet's disease, different kinds of vasculitis. Those can all cause joint inflammation to some extent.
Lupus being, I forget exactly.
Lupus being a kind of a very, very complex disease, where this is another autoimmune disease that causes inflammation, again, in a variety of different body systems, or organ systems. Yeah. This can include rashes. So these some of the symptoms, including rashes, joint pain and joint inflammation, dry eyes and dry mouth. These are sickest symptoms that can be associated with what's called Sjogren syndrome, which is kind of a relative of lupus. Hair loss, sores inside the mouth, kind of Raynaud's syndrome, or where you kind of go outside in the cold and you have fingers and toes that change to red and blue and white. Among kidney damage, a variety of other kind of symptoms in that way. But then probably the third big class is what we call crystalline arthritis. And so what this really is just gout and pseudo-gout, and a couple of other kinds of varieties of other crystal arthritides that are a lot less common. But this is where you have some crystal and in the case of gout, it's uric acid. In the case of pseudo-gout, it's CPPD, calcium pyrophosphate dihydrogenase, that accumulate in both in the bloodstream, but then also ultimately in joints. And so uric acid is a byproduct that normally you're supposed to be excreting. You're supposed to be just kind of urinating this out and kind of getting rid of it. In uric acid, for whatever, or in gout, for whatever reason, you accumulate uric acid. And so your uric acid levels go up, and then people that have gout have a second issue where for some reason that elevated uric acid level is forming crystals inside the joints. And so the white blood cells attack the crystals. It gets to be this big inflammatory reaction. You can have everything from not just swollen joints to actually fevers, chills, sweats. It can look like an infection. And you get gout flares. It's excruciatingly painful. Classically, what's involved are the great toes of both feet, but it can be any joint in the foot. It can be any joint in the hands too. Can actually be elsewhere. It can be the back. Oddly enough, you can happen. You can have gout in the back. It's not very common, but it's not impossible. And this,
gout used to be related to gluttony. The royalty, all that sort of thing. And of course, it's not that way.
Right. So there's an interesting relationship with that, where we have kind of gotten away from aiming at the diet as being part. We do still advise a low gout diet, which is low purines, because purines are what gets metabolized into uric acid. And so high purine foods include things like seafood, beer, certain kinds of wine, sometimes soft cheeses, sometimes nuts, and so on. And so, it used to be, before we really knew how to manage this, that we noticed that sometimes people would go have a big meal of beef or seafood or whatever, and they'd have a gout flare. Now we realize that, and that there are some things that you can avoid, and some people find that managing it that way with diet works. But in general, the overall amount that your diet can influence with gout is actually pretty minimal. And so most people that have severe gout, the diet alone is not going to get them there. And so they need to have, there's kind of a two-pronged approach. There's one approach, which is we need to just knock down the flare, stop that acute inflammation, get people more comfortable so that they're not miserable. And then the long-term approach is actually getting that uric acid level down so that they don't keep having flares. That's actually one of the biggest insights and the best things that we found about gout, is that if we get that uric acid level down, and for most people this is below 6, unless you have tophi or big chunky deposits, then it's actually below 5. If you can get them and keep them below those levels, they don't have gout flares anymore. It's actually one of the most satisfying diseases to treat, because it's like
you can fix it.
You can fix it, exactly. You can fix it. As long as people kind of follow what they need to do, they'll do great. This is not necessarily the case for all of our other diseases. So, however, gout, we have that luxury. We don't have that luxury with pseudo-gout.
Okay. We're going to take a break here.
Absolutely.
And we'll get right back to you. Okay. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Ho, ho, ho. Everybody knows that the Half Off and Hot Buy store in Louisville has super low prices, now or even lower. For Tuesday through Saturday, an additional 50% is coming off all Christmas seasonal merchandise, 40% off the trees, and 20% off all toys. Nobody beats our prices on Christmas seasonal and trees. Don't miss this sale, and unlike other stores, we have plenty of inventory and plenty of staff to help you. Half Off and Out Buy store in Louisville, next to the Medicine Center Pharmacy. Ho, 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 ho. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about treating inflammatory conditions with Dr. Alexander Hannan, rheumatologist from Mercy Medical Center. Have a question? Post it on our live Facebook feed.
All right, well, it's really exciting to have you on the show today because one of the most common problems that I try to help people with when they come in the pharmacy is, I'm in pain, what do I do? So to know that you have the ability to help people with these inflammatory conditions, which so many different things that you've been outlining is the underlying cause, that's really exciting. So what, as a rheumatologist, can you do to help people with joint pain and other inflammatory conditions?
I take a variety of different approaches, and this is it is one of our most common consultations to kind of get, like I said, I even get people sent in from pain management with them kind of asking, what can you kind of do? And so I have seen, even since starting here, patients who were being treated even with narcotic medications who turned out to actually have things like rheumatoid arthritis. And so once you can treat that and eliminate the source of the pain, it's nice to be able to kind of look at that. So my thought process behind all this and the way I kind of approach people, because a lot of people come in with just kind of undifferentiated pain. Now, so the first question is like, well, where is your pain? Is it actually at the joints? In other words, do you have arthralgias, as we call it, and arthritis, or do you actually have myalgias, which is pain kind of between the joints, pain in the muscles, pain elsewhere? So this helps kind of shake down, do people have something like fibromyalgia, diffuse pain syndrome, or do they have actual arthritis? The approach to these is very different. And then I look and I try to isolate any kind of discrete pain points, as I call them. I try to look for specific sites of pain that we can treat easily. So one great example of this, I think, is Trochanteric Bursitis. This is, there's bursa sacs kind of throughout the body that help kind of cushion joints and everything. One of these is right at the head of the greater trochanter, or kind of the hip bone on either side of your hip. And so all the time people come in and they say, I've got pain on the sides, I've got hip pain. Which to me means a lot of different things, because it can mean anything from back pain to, if you have groin pain, that's where the true hip joint is. But it can also mean trochanteric bursitis, which is on the lateral edge of the hip. You can also have iliotibial band syndrome and a variety of other things that cause hip pain. So if you have something like trochanteric bursitis, we can do targeted injections, actually steroid injections into the trochanteric bursa, or you can do physical therapy and different things to help that pain site. And so I try to remove as many of those like isolated pain points as I can, because I think that's, you can kind of break the cycle, and once you've taken away a lot of those individual pain locations, people feel better. Then if I look at joint pain, I treat that in a variety of different ways depending on what exactly it is. So first I get into it and I kind of, you do lab workup, you do a good history and physical, you do x-rays, you look at the patterns on the x-rays, you look at the labs, and you say, what kind of arthritis is this? If it's an inflammatory arthritis, then we go straight to the source, we treat the inflammation with whatever treatment is appropriate, and that helps control the pain. If it's osteoarthritis, then things get a little more freeform because, as I said before, for a lot of situations, there's not a great slam dunk osteoarthritis treatment. One thing that gets done, probably the best treatment for it if you have a large joint, is to actually replace the joint. That's kind of the most evidence-based and kind of most effective treatment. But not every joint can be replaced. Not everybody's a good surgical candidate. Smaller joints in the hands, for instance, generally speaking, are not going to be replaced. Or if there are surgical options, you're looking at just like fusion and things that are really not pretty undesirable. So that leads us to then all these other stopgap measures that we do to try to reduce long-standing osteoarthritis pain. So anything under the sun can be used here, and I tend obviously to stay away from narcotics for obvious reasons. And chronic NSAIDs, things like Advil and naproxen, are also undesirable for other reasons. These cause kidney damage in the long term, ulcers, and so on. So my approach is that I tell patients when we have this kind of chronic pain in different sites, if you have osteoarthritis, another back pain, if you have other joint pain, it's a game of this and that. It's a game of like a little bit of relief from here, something like Tylenol, a little bit of relief from physical therapy, a little bit of relief from joint injections, a little bit of relief from this and that, try to put all of it together. One thing I find myself using more and more in these situations is a drug called Plaquenil. Which is one that, it has a very interesting history. It used to be used for malaria. Then we kind of, nobody uses it for malaria anymore, as I understand. We kind of co-opted it, and now it became our drug used primarily for rheumatoid arthritis and for lupus. But somehow somebody noticed anecdotally that when it was given for rheumatoid arthritis, the patients that had osteoarthritis along with it noticed that the joint pain was getting better. And so the studies have been kind of mixed on this. They don't always show that there's a big benefit to it, but there is a lot of anecdotal evidence that using Plaquenil for this kind of aches and pains and joint pain actually works, that somehow it just has this joint pain relieving property that,
mechanism unknown.
Mechanism unknown, very much so, yeah. I mean, even the anti-inflammatory mechanism is a little bit of a mystery. We know that it kind of diffuses into white blood cells, disrupts vesicle transport and so on, and that's part of it. But how it works for osteoarthritis, whether it actually relieves inflammation or really what it's doing there, is a little bit of a mystery, but it does seem to work. So that's one thing I do when kind of nothing else works and people are miserable, just to try it, see if it makes a difference.
And that's fairly affordable too. So that's exciting.
Absolutely.
Okay. We have to have another break here.
Sure. Right.
You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
You won't want to miss this upcoming Kiko Absolute auction Thursday, December 20th with auctioneer Bill Gill Jr. The entire auction is from Bill Weiss Clock Shop of Cuyahoga Falls. You'll find clocks, watches, beautiful Fenton glass, curio cabinets, prints, unique furniture pieces, antiques, and more. Mark your calendar for Thursday, December 20th at 3 p.m. at the Kiko Auction Gallery located at 3201 Parkway Street, Northwest in Canton. Call Bill Gill Jr. at 330-418-8727 or visit KikoAuctions.com for more information.
Ho, ho, ho. Everybody knows that the Half Off and Hot Buy store in Louisville has super low prices. Now or even lower. For Tuesday through Saturday, an additional 50% is coming off all Christmas seasonal merchandise. 40% off the trees and 20% off all toys. Nobody beats our prices on Christmas seasonal and trees. Don't miss this sale, and unlike other stores, we have plenty of inventory and plenty of staff to help you. Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy. Ho, 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 ho.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's StudioArtsandGlass.com.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Here's your AccuWeather forecast. It's a rather cloudy
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about treatment of inflammatory
garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Ho, ho, ho! Everybody knows that the Half Off and Hot Buy store in Louisville has super low prices, now or even lower. For Tuesday through Saturday, an additional 50% is coming off all Christmas seasonal merchandise, 40% off the trees, and 20% off all toys. Nobody beats our prices on Christmas seasonal and trees. Don't miss this sale, and unlike other stores, we have plenty of inventory and plenty of staff to help you. Half Off and Out Buy store in Louisville, next to the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Today we're discussing inflammatory conditions and treatment with Mercy Medical Center rheumatologist Dr. Alexander Hannan. We will get back to the last portion of the show. Hey, so we were talking early on about gout, and people think of gout as toes and feet. But that's not really the whole case, is it?
No. I mean, that's, classically, the big toe, the podagra, as we called it, was gout affecting the great toes on either side. And certainly that's kind of the most popular joint. It's the classic one. But by no means is that the only joint that gout can touch. So it can hit any of the other toes.
Fingers?
Oh, yeah.
Also?
Sure, certainly.
Okay.
And big joints. It doesn't have to be little joints, although it likes to go out to the little joints because those areas are cooler than the rest of the body. That's the big difference.
God, it has a brain, huh?
You're kind of right, but it's the crystals kind of crystallize in areas where there's lower temperature. And so if you look closely at, your core temperature might be 98 degrees, but the temperature in your fingers, especially on a cold day like this, might only be 75 degrees. That difference in temperature means that there can be a lot more gout going on out there. But it can hit the bigger joints. It can hit knees. It can hit elbows, certainly. It can hit shoulders even. And so, now there is one kind of differentiating factor. We've noticed gout, for instance, does tend to like the feet more than the hands for some reason, although it can go to the hands. And then pseudogout, for instance, or CPPD disease, likes the hands more than the feet. So it's kind of the other way around. But certainly, you can have any in either place. And that I think has confused some clinicians when they kind of see this and wonder, what exactly is going on. But it's relatively easy to diagnose. The classic diagnostic measure is actually to get a needle inside that joint and pull out some fluid. Look at that under a microscope, see the crystals, and then you kind of know for sure what you got. But right.
Ouch.
I don't like that.
We say that, but believe it or not. And this all depends on how you do that aspiration. I do a lot of things to make this a lot more comfortable, and I find a lot of people come to my office when I'm doing either joint injections or aspirations, and they say this is way more comfortable than it's ever been. So for one thing, I use there's this cold spray, Gebauer spray, ethyl chloride kind of sprays.
Okay. That's been around 100 years too.
Yeah, and it's way underutilized. I don't know why people don't use it more, but you get it right in that area. You kind of and that really numbs up the skin pretty well. If I'm doing an actual aspiration, so if it's just an injection, I go in with very fine gauge needles. 25s or even 27s I start using now. And that, because all you got to do is get the steroid in, those are relatively painless. There's some people that I'm pulling out of the joint and they're like, oh, wait, you're done? Yeah. I mean, it works that well. If I'm going in, you do need a wider gauge needle because synovial fluid can be thick.
Yeah.
And so if you're not going to pull anything out, especially if it's inflamed, if you're using something narrow. So you got to go in with an 18 or a 20. But then I use a lot of lidocaine in the area. I still use the cold spray. And that combination works really well. I mean, most people are very comfortable. And especially if you got an inflamed joint, just getting that fluid out of there can make a big difference. And then, if you can inject it, if you know that there's no infection, you can inject it, people get a lot more comfortable right away. But you're not always able to get a needle in there. For instance, like if the joint's not swollen up, like by the time they get to me, if there's no flare anymore, then some other things we rely on, sometimes we look at the uric acid level in the blood. Now this is notoriously, so the uric acid level can actually drop artificially low during flares.
Do all of us have a level of uric acid all the time?
Yeah. Oh, yeah.
Okay.
And it's a normal byproduct, and so most people have kind of a normal range. A lot of people have an elevated uric acid level, but not all those people have gout. That's another confounding factor.
So it crystallizes because
we wish we knew.
Cold,
I mean, some the cold, that kind of the different joints. There's thought to be some metabolic or other genetic difference that separates people who just have a high uric acid level from people who actually get gout. Because if you check uric acid in 100 random people, especially 100 random sick people with metabolic syndrome and so on, you'll find a lot of people with elevated uric acids in the 10, 11 range. But most of those people do not have gout.
What's the normal? What would be the normal?
So about, it varies on the lab, but usually it's listed as about 3.5 to 6.5, sometimes with some differences there. And our targets, so for instance, if you have regular gout and you don't have big chunky tophi, no tophaceous deposits of big chunks of uric acid, our goal is to get you below 6 and keep you there. And if we keep you below 6, we know that you're not going to have flares in the long run. It can be difficult to get you there because, like I said, anytime you move that uric acid level up or down, you're prone to flares. So, we have to usually have people on some prophylactic medication that keeps them from having a flare while we're, jockeying that level around. If you have big chunky tophaceous deposits, we have to get you below 5 and keep you there. And that will actually, what will happen in the long run, you will start to resorb all that stuff. All those big deposits, you'll start to pull them back into the bloodstream. And depending on how big these deposits are, that can take a while. If you've got big chunks of tophi, that can take a year and a half or more to really resorb it all the way. But you can get it all the way.
It's like an iceberg melting.
Yeah,
right? It just takes some time.
Exactly. Absolutely. But now that we understand this, so you've got to be up and kind of prophylax the whole period and everything. But if we can get you below 5, keep you there, resorb all those tophi, we can take care of a lot of the joint pain, we can prevent more gout flares, and like I've said to people, it's the most satisfying disease we have to treat, because it's like the misery factor is really high, the flares are excruciating when they happen, but we can completely make it so that you never have a flare again, as long as the patient's kind of taking the medication and everything. So it's great in that way.
We are really tight on time. We got a lot more to do. Talk about too.
Well, we need to
difference between rheumatoid and osteoarthritis.
Yeah, that's a good one.
Big one is that. So to make a long story short, osteoarthritis is non-inflammatory. It's just by and large wear and tear. What's that?
It just hurts. Or
oh yeah. I mean, it's wear and tear. So it's painful.
So
but
we think of that as like bone on bone. Then is that where we're?
Eventually, you can get there. The issue is whatever damages your cartilage to the point where that's gone means you're bone on bone. Now that can happen with inflammatory arthritis.
Is this where the injection of the colloid type stuff comes into
Synvisc
play?
And those sorts of hyaluronic acids? That can come into play for certain joints, knees especially, and there's been people using it sometimes in shoulders and ankles. The issue with all that hyaluronin injection, it's been very controversial. The ultimate answer a lot of times nowadays is that people don't feel like it works that well. It was thought to be this big revolutionary thing when it came out. Hey, this is great.
I remember.
And then the real effect hasn't been nearly as good as it was sold to be. So in general, I don't do that many of them because they're actually fairly expensive, and sometimes you have to kind of really struggle to get them through insurance. And if you do inject it, it doesn't always work that well.
Well, they tell me it doesn't last very long either.
That too.
And it's
right.
very thick and it's very painful. Is that correct?
The thickness, it depends. So there's several formulations now. The newer ones are not so much. They're not as uncomfortable as some of the older ones, and maybe some of the newer ones do work a little bit better. But you're right. I mean, they're not. It's not a slam dunk. And you're right. It's a transitory thing. So any of these injections, steroid injections, are limited and so on.
Guess what? We're out of time. Too bad. It really is too bad. We got a lot more to talk about. So,
absolutely.
Thank you very much, Dr. Alexander Hannan, rheumatologist from Mercy Medical Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, Kiko Auctions, and of course, technical producer J.D. D'Angelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy, caring for you and about you. Have a healthy week. We'll see you right here next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.
Hi, this is Marian Nipfer from the WHBC Sales Department. For my